In a province burdened by a high prevalence of diseases, the women of this department continue being the backbone of the public health system. We take pride in the fact that most of you are hardworking and dedicated individuals who bring your expertise and kindness to every patient encounter. You are the ones who provide the comfort, care, and compassion that our patients and families rely upon during times of vulnerability. Most of you, as female healthcare professionals, get to witness both the joys of patients' recovery and the pain of their loss. Yet you continue to provide comfort and support with unwavering empathy. Your ability to connect with patients on a human level while maintaining your professional duties bears testimony to your remarkable character. Yet very rarely does anyone take the time to check up on your own well-being. How often do you pause and think about your own state of mind? Abasebenzi bezempilo bayasebenza bayawusiza umphakathi kodwa sikubonile ukuthi in the past baningi abanye abadlulayo emhlabeni abanye abagulayo baguliswa izona izifo lezi siyaye sikhulume nomphakathi ngazo. So okunye ke as part of empowerment ebesikhuluma nabasebenzi bezempilo ukuthi nabo abaqale ngokuyinakekela kuqala so that in future bazokwazi ukunakekela abanye bebe bephila or bazokwazi ukunakekela umphakathi bebe bephila. Sikhuluma ke lapho ngama non communicable diseases isifo sikashukela BP, you can think of it. Saphinde sakhuluma ngendaba ye mental health njengabantu abasebenza ngokugula baphinde babone abantu abadlulayo emhlabeni isikhathi esiningi siknotisile ukuthi kuyaba affecta abanye babo, in fact almost all of them kuyaba affecta psychologically. So sikhuluma indaba ke yokuthi yipi indlela yokuba supporta psychologically ngoba uma bengasupportwa umnyango wezempilo bazongakwazi ukuthi bakwazi ukuphila kahle. So besixoxa ke indaba ze mental health ukuthi kubaluleke kangakanani ukuthi bazinakekele ngoba if bengayinakekeli bona abazokwazi ukuphila long enough ukuze bakwazi ukunakekela iziguli zethu.